So we can pretty much get rolling here. Seems like most of the attendees have filtered in here. So happy to get the ball rolling here. Sam and I are the ones who are presenting. Normally there's like a moderator and then the presenters, but we're acting as both today. So again, Shaq on the account executive side, Sam from the account strategy side. I've been here for about over 2 years now. Been in the programmatic space for about 7. Started off at Criteo and now have been here for, again, almost over 2 years now. Had a lot of time to work on healthcare campaigns specifically. It's ended up being my niche, just more from the sheer volume of those kind of campaigns that we've worked on. And Sam being the account manager that I work with, my dedicated right-hand man, we've worked on all of those campaigns together. Some a little bit more trickier than others. And again, looking forward to kind of walking through how we've navigated those situations and what best practices look like for setting up the best healthcare campaigns.
Hey guys, how's it going? I'm Sam Jensen. I'm an account manager, team lead here at StackAdapt. Been here a little over 2 years, but located in the Boston area. So I've been in the DSP space for a little over 5 at this point. Shaq and I are no strangers to a lot of the healthcare marketers that are in the area. So yeah, they put us in charge of this thing. We're really excited to be here, and thanks again. Great. Yeah, let's take a look at the agenda here, and well, I guess start with who we are. Again, we work at StackAdapt, so we are a DSP, self-serve, independent DSP that marketers can leverage pretty much in their own capacities. So we work with clients large and small across the globe and across really any vertical. So StackAdapt is meant to be a Swiss Army DSP for marketers to utilize in just about any vertical. But as we jump to, as we jump to the agenda, just wanted to highlight some of the things we'll cover today. So Jack's going to start us off with some of the industry trends, and we're going to dive into the targeting options in healthcare. I think that's one of the major questions that a healthcare marketer faces in this space. Then we'll cover a little bit of the inventory that you can access in the programmatic space, as well as some of the executions and tactics you can run. We'll follow it up with analysis at the end, just following up with the different types of reporting you can glean. After that, we'll have the Q&A session. So, Shaq, if you would like, you can lead us off with the first section here.
It would be my pleasure. So kicking it off with just some industry trends, 70,000 health-related searches per minute every single day. And I think a key thing to take away there, nearly 3/4 of Americans obtain health-related information from the net. What this really shows is just, this is where a lot of people are now consulting first, right? There's good and bad that comes with that, of course, but at the end of the day, that is the case. A lot of us, we experience some form of symptom, anything where we're not feeling too well about. I would say about 75% of us, that sounds about right. Consult our phones before we end up going to call an actual doctor or visiting a specialist per se. That's just because of the wealth of information that exists on the internet. And as a result, what we've seen and what industry trends have highlighted is that brands are identifying this, healthcare advertisers are seeing this, and as such, allocating a lot of their ad spend there. So healthcare ad spend in the US is projected to reach about 15.8 billion in 2022 and expected to increase by another 12% roughly in 2023. So that just speaks to the amount of eyes, again, that are consulting digital spaces first as it relates to healthcare research, understanding treatments, how to manage and live with specific conditions. The first place that a lot of people go is the internet, and as such, digital advertising has only grown in importance for these healthcare advertisers. So moving from industry trends, one of the things, again, that Sam highlighted and where we're going to spend a lot of time is understanding how do we identify these audiences, whether that's on the professional side, trying to reach physicians and people who work for healthcare organizations, or even on the pharma side, trying to reach decision makers who work for pharma companies, et cetera. Down to patients and people who are in the process of understanding what they might be, what condition they might be faced with, or what condition they might have, from understanding the symptoms right through to, of course, managing and treating a specific condition. There's a lot of audiences, of course, to reach, but before we get into the actual targeting and the methodology by which we do these we reach these different audiences, it's important to understand the landscape, right? The most important things. One of the things that anyone on this call that I know has run healthcare campaigns you've run into is the restrictions, right? Whether or not you've run into the restrictions, I'm sure they're in your mind and you're just thinking about, okay, well, I want to make sure that I'm doing this as tastefully and, as compliant as I can be. What is the thing that we need to be aware of? HIPAA. What is HIPAA? Health Insurance Portability and Accountability Act of 1996. So it's really just a federal law that means that we need to maintain some level of consistency across how PHI or personal health information is handled, ensuring that it's not disclosed in any way, however it's being used to either track or keep record of for individual patients who are going through specific conditions. So when we think about PHI, what we're talking about is anything that can help you identify the person, patient's name, whatever the condition is that they're living with, the care that they're receiving, information about their personal financials, anything of that nature. All of this would need to be anonymized in order to be leveraged for any form of targeting or any kind of advertising efforts. So anyone who's run these healthcare focused campaigns have probably found yourselves faced with some of these issues, or these are some of the questions that you're probably asking yourselves as you've run these campaigns. Are you achieving optimal scale while remaining compliant? Is your digital audience strategy reflective of, the actual size of the audience that exists, whether that's from your third-party research about specific conditions, or even on the flip side, if there's only 20 physicians' offices in a given target market, you want to make sure that what you're doing from a targeting standpoint aligns with what from a practical standpoint. How effective is your campaign in achieving the initial objectives and goals related to KPIs, and the ways that we can hone in on those KPIs a little bit more? Have you considered including measurement studies, those kind of stuff? There's a lot of moving parts as it relates to healthcare campaigns specifically, but realistically, these are the kind of questions that you're asking for any kind of campaign that you set up. There's just added nuance when it relates to healthcare campaigns, so to speak. And the next step here is just outlining the digital patient journey. So whether you're reaching out to, professionals, physicians, etc., or the people who are faced with these specific conditions or living with these conditions, this is really the cycle that they all follow, right? The professionals might fall into the point of diagnosis, treatment, management, whereas, symptoms are usually specifically people who are living with the conditions or trying to find out more about the conditions. But this is really the flow generally, or the path to conversion, so to speak. So identifying that symptom that you're living with, or kind of making that correlation between that symptom and a potential condition that you might end up getting diagnosed with, receiving the actual diagnosis, identifying the correct method of treatment for that condition, and then long-term management, being able to continuously live full and happy lives despite whatever condition that we might have been diagnosed with. So when we think about healthcare and pharma campaigns from a targeting perspective, one of the heaviest, or one of the most important, or one of the targeting methodologies that we lean on the heaviest will be third-party audiences. And when we say third-party audiences, these are the data sources that we're partnered with, or that any DSP partners with, to be able to compliantly reach these audiences at scale, right? So there's a bunch of different entities that collect all that PHI, anonymize it, of course, and then make it available to platforms like StackAdapt and others to be able to leverage that in targeting and reporting as well. So you see that we have these bucketed out here in B2B and B2C. Adstra, Fluent, Crossix, Purple Lab, Swoop all do a great job of providing, data segments that allow you to compliantly reach, most importantly, people who might be living with a specific condition. There's different providers attain this information in different ways. Some it's based on client offer. Sometimes it's based on user offered information, like they answer a survey or something of that nature anonymously, or sometimes it's based on things like insurance claims data, prescription data. So there's a lot of different ways that this information is collected, and it's important to be able to kind of vet data partners on that basis. How are they collecting data? And then of course testing these against each other is also key as it relates to understanding how they perform against each other. So if we're running a B2C campaign on a condition basis where you want to reach people with a specific condition, maybe we grab one audience from Fluent, one audience from Crossix, one audience from Swoop, and another from Purple Lab. Know that you're reaching the audience at scale. At the end of the day, the audience will be deduplicated, hopefully, and then based on the performance of those audiences against each other, we're able to narrow down and identify which one is yielding the best results. Likewise, on the third-party side for B2B, this is where we think about, for example, AdPrime, Swoop, MedData. Swoop and MedData in particular unlock something that we're going to talk on a little bit more in this conversation, specifically NPI targeting. So NPI targeting being able to reach professionals, specific healthcare professionals on the basis of a national provider index number. So that's one of the many ways that we can reach these audiences, much like the B2C audiences. How we collect that information across these different data sources might differ, but at the end of the day, we know that this is compliant data that allows us to reach these highly niche audiences. So just as we would with B2C, we'd recommend, diversifying the data sources that you leverage just to be able to test them against each other, because bringing it back to digital marketing as a whole and what the process of digital marketing entails, it's really just a bunch of testing, right? It's just a bunch of understanding what is working for the goals that you're trying to accomplish, what's allowing you to reach the audience that you're trying to reach in the most effective way and also at scale, but then also what's helping you drive those end result goals. So there is no shortage of options when you leverage a DSP as far as data sources that you can leverage, but it's very important to kind of keep a close eye on how those audiences are performing against each other.
Yeah, and just to add to that, Shaq, one thing to definitely not sleep on when you're looking to market digitally is some of the supplemental strategies, whether or not you know these third-party data sources, whether or not you typically exclusively work with them, should be always good to keep an eyeball on the other available targeting methods, especially on the retargeting and contextual side, because that will yield you a more efficient CPM as opposed to exclusively maybe just targeting data sources from third-party providers. And another piece that isn't mentioned here is CRM targeting. So let's say we have a list of people, you're an insurance provider, you have a list of people who just enrolled, you don't want to reach them anymore. There is ways to update or upload that CRM information, have it anonymized and matched back to a user ID. So it's completely HIPAA compliant. And an example of a strategy you might utilize that in is excluding people who just enrolled in an insurance plan. That way you're not spending more on users who are already customers.
Very great point, Sam. And to elaborate just a little bit more on that, as far as these third-party audiences, at the end of the day, they're all going to come with a slight increase on the CPM side as far as the data costs associated with them. So that makes something like impression retargeting or site retargeting that much more valuable of a tactic, in the sense that not only can you reach these highly niche audiences through those third-party data sources, but once you've had the opportunity to get in front of those audiences once, you could explore the opportunity of creating a retargeting pool based off of that impression to say, okay, I know I'm already getting in front of the right audience. How can I continue to reinforce that message in front of that audience, but also at lower CPMs, more efficient CPMs? So quick little campaign hack right there. Definitely want to note that one. And another point from a targeting standpoint that Sam had brought up was page context AI. Well, more specifically, contextual targeting. So this refers to just, taking away who the person is and qualifying the placement of an ad completely based on the content that they're engaging with. So in real time, as you continue to educate yourself, whether it be about the management of, living with a specific condition, or at the flip side of that digital patient journey, right at the beginning when you're trying to identify, okay, well, I'm experiencing these symptoms, what could it be correlated to, or what could I possibly have been exposed to in some way? So this is a perfect use case for page context AI or contextual targeting in general, getting in front of users as they are educating themselves at any level of the funnel, right? The key thing about contextual targeting is just making sure that you're describing that contextual relevance as well as you possibly can, so that you're honed in on the right audience. Less focus on, okay, who are these people, and more about, when you're in that phase, when you're in this target audience, what are the things that you care about? What are the things that you're engaging with? What are the resources that you're most likely to kind of consult? And that's where contextual targeting fits in perfectly, right? So you're able to define when and how you want to get in front of these users. It also does great for just brand affinity and, bringing any kind of brand top of mind as people are experiencing a specific thing. And then here we go, just to kind of compound on contextual targeting a little bit, there's a little bit of advancement that we have, particularly at StackAdapt here, called keyword rule targeting. So very similar to page context AI or contextual targeting, it is a contextual targeting solution. However, this just improves the number of rules, or increases the number of rules or control that you have over the contextual placements themselves. You're able to kind of define the placement a little bit more, in the sense of saying, we want this to be in the headline, whereas we want this to appear in the body, or we need this combination of words to be in the body for us to see that as a relevant placement. So this is great, again, to bring it back to healthcare, thinking about symptoms, right? Maybe there's a set of symptoms that we know is specific to a given condition. This is a perfect example here: throat, sore throat, scratchy throat, cough, etc. Those kind of things, you're able to say, okay, I need this combination of words or of phrases to be able to say that this is an appropriate place for us to place this ad. So contextual, both are contextual solutions. One is a little bit broader in terms of the contextual, how you define the contextual segment, whereas keyword rule targeting allows you to hone in just a little bit more. In both cases, we recommend you working with like a strategy team, working with Sam, like whoever your counterpart is on the account executive and account management side, to help you come up with the phrases and terms, or just ensuring that we have enough scale. You're not pigeonholing yourself, so to speak, with being too narrow on the terms or the rules.
Right. Yeah, I think that goes back to kind of the paramount thing and the purpose of utilizing, a programmatic strategy is you do want to scale, right? You're targeting these very niche healthcare professions, or potentially extremely niche and very sensitive conditions. You want to be sure that you're scaling as best you can.
Exactly. And location targeting, nothing too, not breaking the wheel here. Location targeting is something that's been around forever, but this is another tool that we can leverage from a location-based standpoint to identify audiences, whether that's the opening of a new clinic. You want to make people aware who are within close vicinity of that clinic that this is new, right? an interesting case that Sam and I have run before is, people promoting services or health services in places where people go to summer, right? Like you have a lot of audiences that leave their general home or their general space or their general geos during the summer and spend that elsewhere. And that summer time also correlates with a heightened level of activity, right? Unfortunately, a heightened level of activity can also yield to a heightened level of injuries or whatever the case might be, just putting it in a healthcare context. And as such, what we've seen is, raising awareness of healthcare facilities that might exist in a place where a family goes to spend their summer, just because they might not have that level of familiarity with that as they would, back home. So there's different ways that you can use location-based targeting. Just another great tactic to leverage, particularly for proximity-based campaigns.
Yeah, not to jump on the example train, Shaq, but another great one is maybe just like a creative one is oftentimes we run healthcare awareness-based campaigns where they're more PSA focused, messaging like get your flu shot, it's winter. Yeah, being able to geofence locations where there's high crowds of people, for example. Maybe you'll want to geofence an airport over the weekend and then send them with a PSA. That's just another use case. I got excited and wanted to jump on the example wagon there, Shaq, but I'll let you get back to it.
No, great example. Another one, ski resort. You're up there, you're cold, you're gonna be frolicking in the cold. Maybe you want to just promote awareness around flu shots, whatever the case might be. Lots of ways that location targeting can fit into your healthcare strategy, but definitely a vital targeting strategy in general. And again, what we're promoting here is really diversifying your targeting strategies across any kind of healthcare campaign. We want to make sure that we have as many different opportunities to get in front of audiences, because the more that we test out different opportunities is the more likely we are to unlock incremental reach. And as we unlock that incremental reach, we're able to get a better understanding of which tactics are yielding the best results, and then hone in on those accordingly. So recommend spreading yourself as much as you can across the different targeting tactics. Obviously, given budget restrictions are budget restrictions, and we want to adhere to those. But as always, you always want to give yourself the best opportunity, and the only way to give your campaigns the best opportunity is to test a wide variety of targeting strategies. Last couple ones here from a targeting standpoint. I told you we'd spend a lot of time on targeting. We're getting to the end here though. But from the professional standpoint, account-based marketing is another tactic that can be leveraged, right? So when we're thinking about reaching large healthcare systems, reaching decision makers at large healthcare systems, even pharma companies and decision makers at these pharma companies, medical device companies, etc. You have the ability to essentially provide an account list, say the specific company, the specific titles that you're trying to reach, job function, even seniority, to be able to reach these audiences with a level of one-to-one targeting, right? And then you're also able to get that reporting at the granular level, depending on which ABM solution you decide to go with. With StackAdapt, there's a variety of them. So you have, in true StackAdapt form, you have a lot of flexibility as it relates to the different kinds of ABM solutions that you can tap into, including our own proprietary one. But the bottom line is this is a great, ABM represents a great opportunity to identify audiences based on where they work and reach them very specifically in that way. On the professional targeting side as well, we teased this a little bit earlier, but our partnership with MedData allows us to also reach NPI, reach professional audiences based on NPI numbers specifically. So even more granular of a one-to-one targeting method, in the sense that you can identify a physician based on their NPI number, which is a National Provider Index number. That allows you to say, okay, National Provider Identifier. It allows you to essentially identify that user very specifically, and even report back on the number of impressions that a specific physician saw. Maybe you want to target, maybe you have a list of professionals who are oncologists specifically, and you want to reach them with specific messaging. Not only can you hit those audiences specifically through NPI numbers, but then you can also see what the results are from a very granular level. Dr. So-and-so was served 4 impressions before he finally clicked on the 4th one and ended up converting.
Thanks, Shaq. Yeah, the targeting piece is really one of the most important pieces when advertising digitally due to all the regulation, the need for scale. But another pretty important piece that we've experienced, especially depends on the advertiser, but especially with different brands and different sizes, is the types of inventory that you serve on. In the world where privacy and compliance is extremely important, again, scale is going to be one of your #1 goals. And that's really the advantage of using one of the more common routes of inventory targeting, which is the open exchange. So if you're choosing a platform to work with programmatically, what you want to ensure is that they're going to be plugged into as many supply partners as possible. These supply partners are all plugged into the major publishers we know. Some examples are on the next slide. We don't need to jump to it, but because I'll get there in a second. But a lot of these SSPs are plugged into familiar publishers. And the real key to getting scale there is that you would like to access as many supply partners as possible to get that inventory, not just in scale, but also at a much more efficient cost. So make sure whatever partner you're choosing is plugged into a lot of SSPs and has access to all of those publishers. The next piece, besides beyond open inventory, I think another piece that's really important here is, again, the cost efficiency. So when you're trying to hit KPIs such as cost per clicks or even viewability goals, you got to make sure that you're casting as wide a net as possible to be able to reach those KPIs. So again, leveraging a DSP should be able, a DSP you leverage should be able to plug into those sources and also be able to target domains on an inclusion or exclusion basis. So if we jump to the next slide, here's just an example of some of the visual, a visual example of some of the publishers that we are plugged into across the SSPs. These are healthcare specific sites. WebMD, a good old familiar one, and Mayo Clinic. I've visited those about 1.5 million times every time I coughed in college, probably. So like I said, this is not an exhaustive list of what you can serve on, but again, knowing where you have access, forecasting in advance, connecting with your strategy teams to ensure that these sites sell and transact on the open exchange are all good first steps when you're setting up a campaign. You should do this as proactively as you can.
Exactly, and to kind of compound on that, I definitely recommend working with your account managers, your account executives as it relates to identifying whitelists or anything of that nature if you do want to get as specific as narrowing down to specific inventory sources.
In addition to that, I think there are general sensitivities around brand safety and where are we serving. Having domain reporting as well as partnerships with brand safety, ad fraud verification partners is extremely important. On top of it, okay, so we just covered the open exchange where we can apply all these nuanced targeting settings. But what if we could go deeper than serving, a simple demo on inventory that's more premium, right? I think oftentimes, I'm a huge NBA fan. I see a lot of big pharma brands advertising on, live broadcasts of games for NBA, NFL. With a TV buy, you're mainly going off of the network's data or audience, however that's gleaned, right? And in a linear route, you're probably targeting something as basic as demos. But again, what if we could go deeper than just serving demos on these very premium placements? And digitally, you now can. So in a world where transparency is really important and privacy gets you more restrictive with your scales, the box on the left here, the private auction PMP box, is probably the most common route you'll see marketers go, because one, it's very cost efficient, and two, it gives you a wider swath of publishers you can work with. So private marketplace is essentially just a way to enter a brand into a closed off publisher or publisher network, and they are allowed to bid on any of the inventory that these publishers have. So the way this process would go is you reach out to a strategy team to find the publishers that are most important to you that you would like to serve on. They would reach out to the supply partners and they would bundle together a deal. It doesn't necessarily have to be one publisher, it can be multiple. The other two are a little less common, but again, very available and allow you to apply all of the nuanced targeting, but also, again, achieve a more premium tier of inventory, maybe the tier that these publishers would likely sell directly at a even higher CPM. So preferred deals and programmatic guaranteed, pretty much the same thing. The only difference is a preferred deal comes at a fixed CPM and you're not guaranteed an impression volume there. You pay a fixed cost though. Programmatic guaranteed probably comes in at a little bit higher of a cost because they're going to guarantee some volume in a placement. So these are 3 plays in addition to your open exchange strategies that you can explore. And again, it's a great way to step out of maybe your linear and out of home efforts and step into inventory that allows you to basically reach the same audience, but this time you can include all of the targeting segments that you would be leveraging on the open web.
Right, so really important when we're talking about like making sure that we stay in front of those niche compliant audiences, but again, to Sam's point, without the, the inefficiency of kind of having to just throw a wide blanket over everybody and know that your audience lives within the greater general audience.
Mm-hmm. In addition to that, there's other compliant ways to gather data on your patients or maybe even your professional audience. I've seen it used in a professional sense, healthcare lift studies. So these could be any form of measurement of lift. I'm sure you might be familiar with the term where you serve across a control and exposed group, the control group being the audience that you've defined, the exposed group being the people who've seen your branding or your ads or your messaging, and finding out a sentiment towards your brand. And that could be anything, right? That could be, do they recall your brand? That could be a more general question about what their habits are, right? So in a patient lens, we could ask a question like, where do you normally conduct research about a symptom, and have 4 options. So this is a really great way for you to not just measure, lift in a sense on like ad recall or maybe an intent to prescribe, but you can also glean a general insight just by asking more general questions like related to behavior of some sort. So it can go for B2B or B2C. And we've seen this being leveraged a lot more, especially as we go into the potential cookieless future that continues to get delayed like a JetBlue flight. So we continuously are just preparing ourselves for this sort of thing. But having this insight allows you to actually take something back that's actionable at, again, a more efficient cost than maybe one of those, big tier providers like Nielsen or Kantar.
Exactly. Super easy thing to activate within a partner like StackAdapt. We provide the assistance with the development of the survey creatives, and then you have full customization over the kind of questions and answers that can be used to create the survey. So another fun way that this could be used is literally just to understand brand sentiment in comparison to particularly competitors. So, do you prefer this treatment or that treatment, right? Is there a specific healthcare provider that you lean on, or whatever the case might be. So being able to create retargeting pools based off of these responses also is a huge way to continue the messaging or diversify the messaging. Obviously, you don't want to go down the route of creating too much like paths to conversion per se, but it's a great way to kind of understand the audience, but then also tailor messaging a little bit more, or even use those understandings to influence the next flight of a campaign per se. If we realize that 75% of people answered one way, maybe we tailor our messaging to include a little bit of that understanding for the next flight of a particular effort.
Yes, and a good rule of thumb, a great place to start is referencing the framework of the customer journey, whoever that might be. So I know that chart, that diagram in the slides is more B2C focused, but think about it in terms of a consideration phase, an awareness phase, and an intent phase. And when you do that, you can glean a more general, actionable insight about the consumer behavior. It's a great place to start. And then you can continuously ask questions as your campaign progresses. Maybe you get into a new phase, you have your retargeting pools, you ask a different question now, and you continuously refine based on the answers.
Exactly. So yeah, healthcare lift studies are a great way to just continue to gain more insight from your audience, but again, in a very compliant way.
And one of the last and largest pieces we'll spend a little bit of time on here, not too much though, just for the sake of everyone's afternoon, but analytics and reporting. It's very important to know that your targeting inputs do result in, or that the DSP you're leveraging is able to report on whatever you set as targeting criteria, right? That's another general rule of thumb you should be considering when evaluating a partner is, can they report on all of my targeting criteria? And beyond just a reporting suite that a lot of these providers might offer, you can take it a step further, right? And oftentimes we hear the question, how do I know my programmatic strategy is working versus my search strategy versus my social strategy? And the answer is really not that one is doing more than the other, right? One might be better at driving a certain action depending on where the user is in the funnel, but they all work together to ultimately get the user to complete whatever action it is, right? So data passback on conversion pixels is a really, really good way of doing this, again, in a compliant manner. In this example on the slide, we're looking at medical liability insurance. So if you're a medical professional and you're practicing and something happens, God forbid, you're liable to be sued and the hospital won't cover you. Go figure. So there's providers that will help you get covered in the event that you are unfortunately sued, right? Kind of a niche, nuanced conversion point for a pretty general audience, which is nurses. And what we want to be able to say is, okay, is the programmatic strategy working in tandem with these other channels? And so data passback, more of an e-commerce, historically more of an e-commerce strategy, but think about it this way, where you could pass back something like an order ID. You could pass back revenue to measure ROAS. And that order ID could be passed universally across your channels. It could be an order ID that's generated by the site. And with that data, you can then go back and say, okay, we reached this user on our programmatic strategy quite a few times, maybe with 10 impressions. Later on, a week later, we hit them with a social ad, and 2 days later, they searched for us and eventually decide to buy a policy. And this data, again, gives you a compliant way of tying that all back to an individual. Sorry, Chad.
No. I was just saying exactly. It just helps paint the picture of that digital patient journey. You can understand, how your different channels are influencing that user as they navigate through that entire journey. At the end of the day, like, we want to assume a bunch of things about the audiences that we're targeting, but a lot of the times, like, it's not until we run these campaigns and again test till we can really understand how people are responding, what impact that we have, what impact we're actually having on moving people or changing sentiment. So yeah, data passback is absolute gold from an insight perspective.
Yeah, and just jumping on two other slides here. The first being ABM measurement. So we talked about account-based marketing. It's a really great way, again, for you to scale beyond maybe a typical like LinkedIn advertising play where you're very one-to-one. Now you can reach users in a pool, right? Rather than reaching 2 of the 8 decision makers, you could reach 6 of the 8. And you want oftentimes you want that one-to-one measurement that you would see when measuring conversions or any type of performance. So similar to NPI, ABM measurement can be helpful in identifying the certain accounts that are engaging the most, and again, help you refine in a future strategy if there are accounts that are performing weak, or maybe they're showing good site engagement but not quite getting to where you want them to be to becoming qualified lead, for example. Maybe they need more nurturing, so we can refine there. The next piece I'm going to kind of brush over. This is one of our third-party reporting options, unique to, well, not unique to StackAdapt, but again, DSPs might be plugged into different third parties. These providers like Crossix all have their own attribution reporting tools. And this one, Crossix, looks at, Crossix again is a collector of people with different types of symptoms or diagnosis, or even coverage, insurance coverage related to a diagnosis. And what you can do is actually, if you plugged into the DIFA platform for Crossix, which is a specific product for them, you can append a pixel from that platform to your campaigns, so you can analyze the audiences that you would serve with ads. Again, as a way of measuring maybe moving the needle in sentiment.
So the last piece here is just creative ad units and creative best practices. We have some 5 best practices or 5 things to really consider when you're thinking about developing creative for healthcare-based campaigns. Messaging should obviously be, establish yourself with credibility, but then also at the same time understanding the audience that you're speaking to, what they could be going through, and of course, healthcare related sensitive topics. So we want to make sure that we're being very aware of that and any kind of messaging included in creative. Likewise, as it relates to who you're speaking to, make sure that you're speaking their language. I think this applies a little bit more, particularly for the B2B space. If you're targeting physicians, you want to be able to, in your creative messaging, speak specifically to the things that matter to them and resonate with them, so that they're able to, of course, not only express that level of interest, but understand that whatever they're clicking or engaging with is coming from a credible place. Accompany your awareness efforts, whether that's CTV, video, audio, with direct response channels like display and native. CTV, video, and audio, as Sam mentioned earlier, we know that's where a lot of healthcare dollars get spent from an ad perspective. Television, we all have been bombarded with some random medication ad, whether or not we suffer from that specific condition. But supporting those kind of messaging, firstly, using something like CTV to make sure that those ads are only being exposed to the people who we know that will resonate with is huge. But then supporting that with something like a direct response channel, display, or native, reinforces the message, but then also offers them the opportunity to click directly to whatever the landing page is, learn more, get more content, or even take a definitive action in the form of booking a scheduling consultation with their physician, etc. Tailor messaging to where your audience might be in the digital patient journey. Sam also alluded to that earlier, just making sure that we're adhering to any kind of where we want to reach. If this is if we're trying to promote some form of treatment for the management of a long-term condition, we want to make sure that we're speaking to that. That's a whole different space from maybe a diagnostic testing. Maybe you're promoting some kind of diagnostic testing option or something like that, where you're trying to reach people in the symptoms phase, where they're trying to figure out what exactly these symptoms mean. We just want to keep that in mind and make sure that you're speaking specifically to that. And then, of course, finally, aligning the KPIs and the creative messaging with whatever channel is being used. CTV, video, audio, we know what those are. Those are awareness, and they live at the top of the funnel. Let's pay attention to the things that we can influence at that level of the funnel, which are like, engagement, completed videos, completed listens, and site visits that result from that, or increase in any kind of organic traffic or anything of that nature. Display and native, we can look at direct things like CTR, the time on site that's spent after that click through, those kind of things. So we just want to make sure that we're aligned with the channels that are being leveraged. And then from a best practice standpoint, we've got information safe ISI units, which refers to important safety information. We've all had those ads, again, referring back to the TV ads that we all see, where that long paragraph is uttered at the end to letting us know all the things that they are legally required to kind of let us know in any form of ads. You can incorporate that in your display and native ads, and it's a unique unit that we are able to offer here. That's something that our creative team is able to help you enact or incorporate in your ads. And then finally, we spoke to weather targeting as well, which I know is of course like a hot topic as it relates to healthcare. Like for example, the low-hanging fruit there, flu shots. If you're thinking about, just from a practical standpoint, it gets colder, flu season picks up. We've got RSV going around now too. There's all sorts of cold or weather-related conditions that we can use weather triggers to speak specifically to. Again, back to the overall messaging and the overall guidance of making sure you're speaking the language of the specific people you're reaching, so you can actually set up campaigns to be triggered or change or serve a specific type of campaign based on something as basic as a weather condition. So once we drop below this certain level of temperature, we want to start showing these kind of creatives. As temperature picks up, or even on a rainy day, we want to make sure that we serve this kind of creative as opposed to what we show on a sunny day. So just different ways to diversify and continue to get the messaging to the people who you're trying to get them to, but then also make sure that they understand you're speaking directly to them. And finally, just to wrap up, these are just kind of highlights of everything that we went through today. I want to open up the floor to answer some questions. Doesn't look like we got too many questions, so we have a little bit of extra time here. But to go into the wrap up here, at the end of the day, people are consulting the digital landscape just as much as they're consulting their doctor. And as a result, like, marketers need to understand that that's where people are. And we're seeing it already. Ad spend continues to be funneled into the digital landscape to make sure that they're getting in front of the audiences that they're trying to get in front of and where they are. Think about where your audience lives online at different phases of that digital patient journey. We alluded to that earlier. And measure the outcomes of your performance inside one platform. StackAdapt does afford that, thankfully. So the more centralized that you can be with everything from targeting right through to reporting, and the more granular that you can be within a single platform, really just improves your agility, your ability to understand how things are performing and quickly enact that understanding of how things are performing, or quickly make updates or optimizations rather to any campaigns based on how things are performing in real time, whether that's at the audience level, creative level, or just overall strategy.
And it looks like we do have one question in. It says, are you able to pass back CRM data based off offline conversion events to exclude converted users from future targeting? Yes, but it wouldn't work in the form of data passback. So data passback is referring to, elements of your web page that you could pass back. Think of like a submission form, for example, where a user might be entering some form of information, first name, last name, I don't know, an email address, a location, right? There are other fields though, when they're filling out these forms, like an order price, maybe an order ID, that's what you would want to pass back in data passback. With the CRM piece, what you would want to do is continually upload and match lists of people who were recently converted in whatever capacity that is. They could have even signed up for something more informative like a webinar. To exclude those people, what you would want to do is get an updated CRM list and update that as much as possible in whatever platform you're using. It would be excluded within the targeting parameters of the campaign. There's another way to do it. We can actually place a retargeting pixel where conversion occurs, right? So if you would rather not do the work of uploading a CRM list of insureds, for example, in an insurance space, what you could actually do is place a retargeting pixel in the exact same spot that you're tracking the conversion or the form submission and exclude people who responded already.
Exactly. And that brings us to the end of the presentation here. Floor is still open for more questions. If there are any questions that the conversation brought up or any kind of topics that we'd love to explore, we do have about 5 minutes left here.
Oh, I see one came in for CTV. Do you have any inventory for CTV available, and how easy is it to get set up? Great question. StackAdapt specifically has a wide swath of CTV inventory. Again, we're plugged into a whole lot of supply partners that you might be familiar with. Don't want to name too many names, but an example of an SSP partner, and the reason why it's valuable is, like take a Freewheel. For example, they partner exclusively with like the NBC Universal properties. NBC Universal leans on them for pretty much transacting all of their digital inventory. So we have a partnerships team that's continually building these relationships and being able to secure this inventory via the 3 deals that I highlighted earlier in the inventory section. And basically, if you have an ask or you want to know if a certain publisher has ad supported inventory for CTV, please reach out and find out what they can secure on their end, because that sounds like more of a PMP route where beyond our run of network, you could get something customized for you if there's very stringent requirements.
Exactly. And just to compound on the CTV piece, another really interesting way that those are used is just the deals that Sam had referred to in the inventory part. One of the most fun ones that I feel like people are leveraging now is those live event deals. So we're able to tap into that through partners like Hulu, for example, and reach those really specific audiences, but then also when they're really engaged with those, live events, whether that be an NBA game, NHL game, or whatever the case is. It's sports season, so there's no shortage of live events to choose from right now. Looks like we got one more question as well.
Yeah. Is ABM targeting available via self-serve? Shaq, you want to take this one?
Yeah, for sure. So currently ABM targeting is not something available in the StackAdapt platform like self-serve, but there are a bunch of different like B2B targeting options that are readily available from the third-party catalog. For example, like specific specialists, right? You want to reach oncologists. There will be metadata segments and swoop segments within the StackAdapt catalog, third-party catalog that you'd be able to tap into. And just because working on a self-serve basis doesn't mean that you don't have access to things that aren't directly in the platform quite yet. I don't want to give away too much, but we expect that to be something in the platform pretty soon. But yes, it's something that you could always reach out to your rep about, just with the list that you're trying to create an ABM audience from, and then also any kind of parameters that you want to have applied to the ABM segment.
All right, looks like we're coming up on time. Any others? It looks like nothing's coming in other than those 3 for now. But if there are follow-up questions, you can feel free to reach out to us, even Shaq or myself. If you're working with StackAdapt already, please reach out with your rep or the team that you're regularly in contact with any questions. But again, as a reminder, we have this webinar recorded. We can always go back to this and share with you. And again, we would like to thank everybody so much for their time today. We appreciate you guys taking the hour with us.
Likewise. Thank you so much for the time, everybody. Again, we'll share this afterwards. Please don't hesitate to find Sam and I on LinkedIn, whether StackAdapt clients or not. Love to meet new people, but appreciate everyone taking the time again. Have a great rest of the week.
Take care.